Mentally sharp, physically active, and fully independent, he had built a life where he needed no assistance, walking miles each morning and managing his daily routine without difficulty. One day he came in for what seemed like a simple, routine medical checkup. There were no alarming symptoms, nothing urgent. However, that single visit set off a chain of events. One test led to another, then a referral, followed by a procedure. What began as precaution slowly evolved into complications. Within 6 months, his condition had declined so significantly that even walking to his mailbox became a struggle. The issue that started this journey was never something that would have affected his quality of life in any meaningful way. Instead, it was the process of investigating it that changed everything. This is not an isolated story. It reflects a pattern that quietly unfolds in healthcare systems every day, particularly among older adults. The intention is always to help, to detect early, to intervene before problems escalate. But sometimes that intention doesn't align with outcomes. Medicine, while powerful and life-saving, can also introduce risks that are not always clearly communicated. Especially as we age, the balance between benefit and harm becomes more delicate. What worked well at one stage of life may not apply in the same way later. This is the conversation many people never have, yet it is one of the most important discussions to understand as we grow older and continue making decisions about our health. There is an important shift that happens with age, and it often goes unnoticed in standard medical practice. When someone is younger, especially in their 40s or 50s, early detection of disease is usually beneficial. Finding a problem early often allows for simpler treatment and can significantly extend life expectancy. This approach has been deeply ingrained in modern medicine, and for good reason it has saved countless lives. However, as people move into their 70s, 80s, and beyond, the same approach does not always produce the same results. The body changes, the way diseases progress changes, the ability to recover from procedures changes. Yet, many medical guidelines continue to apply the same principles without enough adjustment. This creates a situation where older adults are often subjected to screenings and interventions that may offer very limited benefit while exposing them to significant risk. The uncomfortable truth is that a test that could add decades to a younger person's life might only add a short period for an older individual, and that time might be spent dealing with the consequences of treatment rather than enjoying life. This is not about avoiding medical care. It is about understanding that the equation changes with age. The goal should not always be to detect and treat everything possible, but to carefully consider whether the intervention will truly improve quality of life. Asking thoughtful questions and understanding the purpose behind each recommendation becomes essential. Without that awareness, many people unknowingly enter a system that continues moving forward, even when stopping to reassess might be the better choice. One of the most important concepts to understand in this context is something often referred to as a cascade of care. It begins in a very simple and seemingly harmless way, perhaps with a routine test or screening. The results might show something borderline or unclear, prompting further investigation that follow-up test may reveal. Another finding leading to additional procedures. Each step feels justified in isolation, but together they form a chain reaction. For older adults, this cascade can become particularly risky. A small issue that might never have caused harm can lead to invasive procedures, medications, and complications. For example, a minor abnormality could lead to a biopsy. The biopsy might cause a small complication, such as bleeding. That complication requires monitoring, which might uncover another issue. Soon, medications are introduced, each with their own side effects. Dizziness, fatigue, or confusion can follow, increasing the risk of falls or further health problems. What began as a precaution can evolve into a significant decline in overall health. This process is rarely explained in advance. Most people assume that more testing automatically leads to better outcomes, but that is not always the case. Especially in older populations, the risks of each step can accumulate quickly. Understanding this cascade is crucial because it highlights the importance of asking whether each step is truly necessary. It encourages a more thoughtful approach to care, where decisions are made not just based on what can be done, but on what should be done in the context of an individual's age, health status, and personal goals. Consider one of the most commonly recommended procedures, screening of the colon, for individuals in their 50s and 60s. This test has proven to be highly effective in detecting early changes that can prevent serious disease. It is widely supported by research and has contributed to reduced mortality rates. However, after a certain age, particularly beyond 75, the situation becomes more complex. The progression of many conditions detected by this screening is slow, often taking a decade or more to become dangerous. For someone in their late 70s or 80s, the likelihood that a small finding will ever impact their life is relatively low. At the same time, the procedure itself carries risks. Preparation for the test can be physically demanding, leading to dehydration or electrolyte imbalances. Sedation, which is commonly used, can affect older individuals differently, sometimes causing confusion or longer recovery times. There is also a small but real risk of complications. During the procedure itself, these risks are not always emphasized in discussions, yet they are critical to consider. The decision to undergo such a test should not be automatic. It should involve a careful evaluation of overall health, life expectancy, and personal preferences. The key question becomes, if something is found, what would be the next step? If aggressive treatment is unlikely to be pursued, the value of the screening may be limited. This does not mean the test should never be done, but it does mean that the decision should be individualized rather than routine. Screening for certain types of cancer presents a similar dilemma. Tests designed to detect early signs of disease are often viewed as responsible and proactive. The idea of catching something early feels reassuring. However, in older adults, not all detected conditions pose a real threat. Some grow so slowly that they would never cause symptoms during a person's lifetime. Despite this, once a potential issue is identified, it often leads to further testing and treatment. For example, blood tests used to screen for prostate conditions in older men can detect abnormalities that might never progress. Yet, an elevated result can lead to biopsies and treatments that carry significant side effects. These treatments can affect quality of life in meaningful ways, including issues related to daily function and overall well-being. Similarly, screening for breast conditions in older women can identify slow-growing changes that might never become harmful. Still, the discovery often triggers a series of interventions, including surgery or other therapies. The emotional impact of a diagnosis, combined with the physical effects of treatment, can be substantial. The key challenge is distinguishing between conditions that require action and those that can be safely monitored. This requires honest and open conversations between patients and healthcare providers. Understanding the likely course of a condition and the potential impact of treatment is essential in making informed decisions that align with personal values and priorities. Heart-related testing is another area where careful consideration is needed, especially in individuals without symptoms. Tests designed to evaluate heart function can sometimes identify abnormalities that appear concerning but are not actually causing problems. In older adults, these tests may produce results that lead to further procedures, such as invasive imaging or interventions. While these procedures can be valuable in certain situations, they also carry risks, including complications related to the procedure itself. Research has shown that in some cases, managing heart health with medication and lifestyle adjustments can be just as effective as more invasive approaches. This highlights the importance of focusing on what truly improves outcomes. Maintaining healthy blood pressure, managing cholesterol levels, staying physically active, and avoiding harmful habits are all well-supported strategies that contribute to heart health. These approaches carry minimal risk and provide broad benefits. In contrast, pursuing additional testing without clear symptoms may not always lead to better results. The decision to proceed with such tests should be based on a clear understanding of what the results would change and whether those changes would meaningfully improve quality of life. Without that clarity, there is a risk of entering a cycle of interventions that may not provide the expected benefits. Bone health is another area where routine testing can lead to unintended consequences. Measuring bone density is a common practice, especially in older adults, as it helps identify the risk of fractures. While the test itself is simple and non-invasive, the results often lead to treatment decisions that require careful consideration. Medications used to strengthen bones can be effective, but they also come with potential side effects. In very elderly individuals, these side effects may outweigh the benefits. Additionally, the focus on numerical results can sometimes overshadow more practical strategies for preventing injuries. Falls are a major cause of fractures, and preventing falls is often more impactful than focusing solely on bone density. Simple measures such as improving home safety, maintaining muscle strength, and addressing balance issues can significantly reduce the risk of falls. Ensuring adequate nutrition and reviewing medications that may cause dizziness are also important steps. These approaches address the root causes of injury rather than relying solely on medication. The key is to shift the focus from treating numbers to improving overall function and safety. This perspective allows for a more comprehensive approach to health that prioritizes independence and quality of life. Another example involves imaging of blood vessels in the neck, which is sometimes used to assess the risk of stroke. While this test can identify narrowing in the arteries, its usefulness in individuals without symptoms is limited. Detecting a blockage may lead to recommendations for procedures aimed at reducing stroke risk. However, These procedures themselves carry risks, including the possibility of causing the very problem they are intended to prevent in asymptomatic individuals. The likelihood of benefit may not outweigh these risks. This underscores the importance of understanding what a test result will lead to if the outcome of the test does not clearly guide a beneficial intervention. Its value becomes questionable. Instead, focusing on proven strategies such as managing blood pressure, maintaining a healthy lifestyle, and taking appropriate medications can be more effective in reducing overall risk. These measures address the underlying factors that contribute to health problems without introducing unnecessary complications. The goal is to ensure that every test and intervention has a clear purpose and a realistic expectation of benefit. As people age, the goals of medical care naturally evolve. The focus shifts from simply extending life to preserving its quality. Maintaining independence, mobility, and mental clarity becomes increasingly important. This requires a different approach to healthcare, one that emphasizes function and well-being rather than exhaustive investigation. Regular checkups remain important, but they should be tailored to individual needs. Managing chronic conditions, ensuring proper nutrition, and staying physically active are key components of this approach. Preventive measures such as vaccinations also play a significant role in maintaining health. Additionally, reviewing medications regularly is crucial, as taking multiple medications can increase the risk of side effects and interactions. Simplifying treatment plans whenever possible can improve overall outcomes. This approach recognizes that more intervention is not always better. Instead, it prioritizes what truly matters to the individual, ensuring that medical care supports their ability to live independently and comfortably. Communication plays a central role in achieving this balance. Many people feel hesitant to question medical recommendations, fearing that they might appear uncooperative. However, asking questions is an essential part of participating in one's own care. Understanding the purpose of a test, the potential outcomes, and the associated risks allows for more informed decisions. It is important to ask what will happen if a test finds something and whether that outcome will lead to meaningful improvement. Discussing alternatives, such as monitoring a condition rather than immediately treating it, can also provide valuable perspective. These conversations may take time, but they are crucial in ensuring that care aligns with personal goals. Bringing a list of questions to appointments and involving a trusted person in discussions can help facilitate these conversations. Healthcare providers generally want to provide the best care possible, but time constraints can limit detailed discussions. Taking an active role helps bridge that gap and ensures that decisions are made collaboratively. Ultimately, the most important takeaway is that healthcare decisions should be individualized. There is no one-size-fits-all approach, especially in later life. Each person's situation is unique, shaped by their health status, preferences, and priorities. Recognizing this allows for more thoughtful and personalized care. It encourages a shift from routine practices to intentional decision-making. By focusing on what truly matters, maintaining independence, avoiding unnecessary harm, and enhancing quality of life, individuals can navigate the healthcare system more effectively. This approach does not reject medical care but refines it, ensuring that it serves the individual. Rather than following a standard template, making informed choices requires awareness, communication, and a willingness to ask questions. These steps empower individuals to take control of their health and ensure that the care they receive aligns with their values and goals.